we've been waiting for this maybe even more than we normally do. It is time for Cleared to Play, and we take you inside the tent to get you updated on the latest injuries in the Bay. Proud to partner with UCSF Health on this segment and bring in Professor and Chief of Sports Medicine at UCSF, Dr. Brian Feeley. Hello, Doc.
Hey, guys. How are you?
We're doing fine, except for we're scratching heads a little bit with this Brock Purdy news. Still inflamed 3.5 weeks later, and now surgery is put off. What's your reaction?
Yeah, I got to be honest. I'm kind of confused, too. This isn't something that we would normally delay for. So either something new came up on his exam or there's something else going on that's causing a delay. So there could be some soft tissue inflammation that typically would have gone down by now, but maybe he's got a bursitis in the back of the elbow that they really need to get him to decrease and go away before they can operate. But in all honesty, I'm as confused as you guys.
So this doesn't necessarily indicate that the severity of the UCL injury is worse than what we previously would have thought.
No, I don't think so at all. I think it just means that he's got some swelling. They would rather hold off. And I don't think long-term it changes the timeline. So if it increases the predictability of the surgery a little bit, and that may save a few weeks on the other end, I think it's totally safe. Waiting a little bit for this surgery, if there's any doubt, is always the right answer. So my guess is the team doctor or the person doing the surgery is likely the team doctor for the Rangers, knows what he's doing around elbows, and he's going to do what is going to be the safest, best long-term option for Brock Purdy. Okay,
so your lack of concern, but the height of confusion, I want to hear more about that. So because we read some other things from other doctors out there today who were saying, yeah, it makes sense that it would still be inflamed if it's a significant UCL injury, and it looks like this one is. So tell me a little bit more about what exactly is confusing.
Sure. So I think without seeing the imaging, it's tough to say. And the severity of the injury doesn't necessarily predict which surgery we're going to do. So when we look at Brock Purdy, we're looking at two different potential surgeries. One is the suture augmentation, where you put essentially a suture brace, which is an internal, essentially heavy suture into the area to allow what is a healthy ligament that popped off the bone to heal. That's the one that they talk about having a 5 to 6 month time point in terms of return to play. The other option is you say the entire tendon is shredded, it's not reconstructable, we need to give him a new tendon, which is essentially the Tommy John surgery. That's the one where you're looking at 12 to 15 months. The confusion is that inflammation, unless it's really severe, doesn't usually slow down this surgery all that much. That being said, if his elbow is really still swollen, waiting a couple weeks to allow the muscles to recover, to allow the soft tissue and the skin and everything else around the elbow to have a more predictable recovery and get him into physical therapy a little bit faster afterwards is always going to be the right call.
What's the nature of inflammation continuing to persist after this length of time? Does it vary from human to human, or does this indicate maybe that there's been some additional usage or some mobility in the arm that's kept the inflammation high?
Yeah, I think it's pretty variable. Some people tend to swell a lot with relatively minor injuries. It's probably due some to the severity of the injury to the soft tissues around it. So you've got the muscles that flex your wrist or bend your wrist towards your elbow. And if those have a partial tear in it as well, there could be a little bit more bleeding. You can have enough of an injury also when you have almost a near elbow dislocation when your arm is bent back like that some of the joint fluid inside the elbow could have for a few weeks been persistently leaking out and causing a little bit more swelling.
Dr. Brian Feeley with us here on Cleared to Play. So just to kind of put a bow on that, and then I want to ask you about Steph, but to put a bow on that for people who are maybe just tuning in, you do not think that this necessarily means anything bad, and it certainly doesn't even take week one out of play.
Yeah, I don't think it means anything bad. I think it means that they're being conservative, and if they do the internal bracing procedure, he's still on track for being back mid-August, being ready to play by week one. And if he has the other procedure, he's gone for the season. So waiting a couple weeks to make it a more predictable rehab, I think is totally fine.
Yeah.
And Twitter and the 49ers world should not panic.
Okay.
Yeah, we're trying not to panic.
Well,
but,
Twitter's always going to panic. We're not going to do anything about that, Doc.
Yeah, and we were hoping, Doc, today to have news that the surgery was, quote, a successful surgery, as most of the surgeries that you guys perform are of that nature. The Gary Payton, the second injury, is a curious one. They traded for him, and he was playing in Portland. Now he's out with the Golden State Warriors. What do you think the return to play is for the injury of this nature?
Yeah, honestly, I think they're doing everything right and letting him completely rest. When you have any of these groin and core muscle injuries, there's a whole host of things that attach down in that area. So you can imagine at the bottom of your stomach muscles is also where the muscles where your hip adductors, the muscles that turn into your groin, originate. So you can have a successful surgery in that area, but as you're recovering, be more at risk for having a groin strain. And honestly, my guess is it really depends on how the next few weeks go. If the Warriors are looking good without him, are still in playoff contention, I would rest him as long as possible and get him healthy for a playoff push. If it looks like we're falling out of contention, I'd get him ready for next year.
What about Steph, Doc? Can we answer it this way? Like, at what point should a Warrior fan get concerned if he's not back on the court?
Again, I think it depends on the record. I think with this injury, it's a really uncommon injury. So even in football and other collision sports, we rarely see injuries to the tibia and fibula up that high by the knee. So it's really going to be based on how he feels and how his recovery trajectory is feeling. This is something that I would assume that he's going to have to be totally pain-free for and feel like he can do all the jumping and landing in that area. So, I would say on average another 2 weeks before even thinking, gosh, this is taking longer than expected.
Doc, great stuff, and thank you as always.
All right, guys, take care.
Okay, the proceeding was sponsored by UCSF Health, Dr. Brian Feeley.